North Texas region, and we were so pleased to partner with one of our key partners here, Texas Census Institute. And I'm going to introduce our moderator here. Angela and her team were great to help us kind of put together this amazing plenary session, because one of the things that we wanted to do was have this plenary kind of really focus on more of a regional perspective on what's happening with regards to population growth, but really, you know, how the importance of data really can drive, you know, policy making and decision making. So this afternoon's plenary is Powering Growth: Why Accurate Population Data Fuels Economic Success and Thriving Communities. So, so it's my pleasure to introduce our moderator for this afternoon's plenary. And our moderator and my frequent collaborator is Angela Broyles, the founder, president, and CEO of the Texas Census Institute. Angela's vision for the Texas Census Institute grew out of her work on the Texas Counts campaign. It was like really leading up to the 2020 census, right? Having been hired by the Community Foundation of Texas to manage partnerships and investments to support the 2020 census, Angela became engaged in efforts across the state and gained a deep understanding of the importance of census data. After a career spanning several startup companies, her passion for this work led her to launch the Texas Census Institute to ensure the planning, collaboration, and research needed to elevate the importance of the census and the American Community Survey, and continues to ensure that Texas remains the best place to live and work. So glad you're here with us, Angela, and for bringing this great panelists together. So we'll turn it over to you.
Great, thanks, Monica. Can y'all hear me okay? Nope. Is it on at all? Yeah, okay. Can y'all hear me? Everybody good? Okay. Hi, everybody. Thank you for being here. And of course, Texas Demographic Center, Monica, Lloyd, and their team, thank you for having us here today. So we're excited to have this, this panel discussion, because we've heard a lot about the population data, its growth, how it's used for estimates and infrastructure to understand our communities. But what happens when the data is not correct? And unfortunately in Texas, in the 2020 census, we had an undercount. The Census Bureau estimates they undercounted the state of Texas by 500,000 people, which is about the size of Lubbock, I think. So it's quite a few people. And also because of that, we looked at the federal programs that are distributed using that population data. And we estimate that over the next 10 years, the state loses $25 billion because of those folks that were undercounted. So to us at the Texas Census Institute, it's really important that we overcome that challenge and that we work towards a better census in the 2030 and all of the surveys that the Census Bureau works on, such as the American Community Survey. Sorry guys, I'm getting over a little something. It's like Dallas allergies. So anyway, this is what we're doing here at the Texas Census Institute, is really working towards a more accurate 2030 census so that we can have better data that underpins all of these population estimates that we use. So one of the things that we do to promote the census is we're working on educating people and stakeholders and policymakers and folks on the ground as to the importance of census data and why it's important that it's accurate for our planning, for our understanding our communities and whatnot. So that's basically what brings us here today with this panel discussion. We have some very esteemed people that are from different industries in this panel that are going to talk about how important census data is to their sectors. We have business, we have city management, transportation, and hospital systems. And we're going to hear how their industries rely on accurate census data, how it informs their decision making and advocacy, and then also what happens when the data is not accurate. So without further ado, I will get started. So I'm going to let everybody introduce themselves, but I will give everybody a quick intro. We have Steve Love, who's a CEO of the DFW Hospital Council. Andrea Coker, she's with North Texas Commission. She's going to talk about business, and she's their Chief Advocacy Officer. We have Opal Mauldin-Jones, who's the City Manager of Lancaster, and Drew Campbell, who's the Executive Director of the Dallas Regional Mobility Coalition, to talk about transportation. So without further ado, I'll let them talk about their work and what they do. Steve, you want to go?
Okay. Can you hear me okay? Great. As Angela said, I'm Steve Love with the DFW Hospital Council, and want to thank the Texas Demographic Center for having us here today. We look forward to the discussion. For those of you not familiar with Hospital Council, we represent 90 hospitals here in the DFW area We cover a 17 county area. And we use a lot of data that we have. We do a lot of research of that data, and we share some of the best practices with our hospitals. We advocate on their behalf. But when the hospitals come to the hospital council, we're Switzerland. Even though they come to the hospital council, it's what can we do to improve the health of the community. And that's why they will be 100% behind accurate census counts. Now, when my board meetings are over and their cars leave the parking lot, they're competing before they get out of the parking lot. But when they're here at the council, they work together for the good of the community. I've been in healthcare over 50 years, and it's a real privilege to be here today.
Hi, I'm Andrea.
Push it up.
Hi, I'm Andrea Coker from the North Texas Commission. We are a public and private member organization with large businesses and cities across the 13 counties and almost 8 million people that make up North Texas. Similar to Mr. Lowe here, many cities are members of the North Texas Commission. We go and advocate for things both in Austin and DC that are better for the region, and then they go compete for the same businesses to move to their cities against each other. So accurate data, both regionally and specifically in our cities, is a frequent topic of ours.
I'm Opal Mauldin-Jones. I am the city manager for the city of Lancaster. My most recent role was the immediate past president for the Texas City Management Association. And like everyone just before me, we represented all cities of all sizes in the state of Texas from a local government perspective of city management and administration. I've been in local government for the last 25 years, and 30 of my years of career have been in the government sector. So really happy to be here on today.
Good afternoon, Drew Campbell. I'm the executive director of the Dallas Regional Mobility Coalition, and I'm the least esteemed person here because I'm a registered lobbyist, and I have been for 45 years here in the state of Texas. We moved here in 1980 to Dallas-Fort Worth when there were about 2.3 million people living in Dallas-Fort Worth, and we've got, close to 8.5 million. So things have changed. What we do at the Dallas Regional Mobility Coalition is we advocate for transportation dollars, all transportation dollars, whether they're federal, local, state. And our job is to make sure that we have a steady stream of transportation dollars flowing into our region because it's growing at an exponential rate. I mean, when you think about it, I love to tell people, we sell more new cars and trucks in Dallas-Fort Worth than they do in 45 states. So we need transportation dollars here. We need more roads. We need more transit. We need more real, I think, innovative ideas about how to create mobility for our citizens and keep the quality of life here. But at the end of the day, it's very important that we have the proper census count for any number of reasons. Because when you think about it, you got to know where people are so you can figure out where people are going to be. But at the same time, the way that the dollars flow into our region is based upon head count. So it's very vital to our group to know that we have an accurate number of folks at the census. And when you think about 500,000 people, that's an incredible number of people. It's more than 7 states have that we lost. Those 7 states now are going to step in front of us for all those transportation dollars because we didn't get that 500,000 people counted. Plus the fact, just think about it, we could have one more crazy congressman if we just had another 500,000 people on our census. But with that, I really appreciate being here today. Hope you enjoy it. I love interaction. Anybody have any questions? I'm not afraid to answer any questions about anything, football, baseball, and I'll even tell you maybe some inside stories about what's really going on in Austin. But with that, I really appreciate you having me here today.
Thank you so much, guys. Yeah, I'm really glad that everybody else is happy to talk because, like I said, fighting some allergies, so if my voice is a little shaky, I'll just turn to them to talk. So, very good. All right, well, now I'm going to talk to all of you guys. I'd like for each person to answer or speak to the first topic, which is just about how your industries use population data. So how does population data shape the decisions you make? How does, and why is accurate population data important? So I'd love for each of you all to answer. So Steve, do you want to go first?
Sure. The population data and the census especially is so important. It impacts Medicare reimbursement. It impacts Medicaid reimbursement. Some of the Medicaid is partially tied to the population, the location, the age, the demographics, and you want it to be accurate. That's one thing. When you look at other things that impact the health of the community, it's going to impact as you look at infrastructure, like schools and transportation and highways. All of that impacts a person's health. And then finally, I think just giving you the executive summary, as you look at some of the areas where there is poverty and poor transportation, don't have proper schools, that is going to be ingredients for a bad, healthy lifestyle. And that's going to cost more dollars. So the more accurate the data, the better informed decisions we can make about health care.
And from a business perspective, most of our members are large businesses in the area. Many of them, the Fidelities, the Toyotas, they moved here in the last decade. We know from them that they used census data, not just census data. We consider that the bottom of the pyramid. There's consumer data layered on top of that. There's education data layered on top of that data scientists use. But we know that the foundation of that is the census data. And so when that foundation is shaky or inaccurate, we lose businesses here in North Texas. We know that the more accurate that is and the better picture we can give people of exactly what's going on in North Texas, because we know it's great. We don't lack many things, and confidence is not one of them. We call it the Texas miracle. It is, but we've got to have the data to back up that confidence.
And with cities, we're the nucleus. So we have the hospitals that are in some of our communities. We're all competing for business industry. Transportation, if you can't move around, things can't happen in the community, whether that's by road, whether that's by rail, bus, or water, or air. Even we have a regional airport in my community. And so accurate data impacts everything we do, from how many new water lines do we need to upgrade, the size of those lines. Do we need to be out talking to the larger hospital districts to have clinics or other ancillary services in our area? Recruiting businesses, the census data, the demographic portion of the census data is vitally important to cities, because it's how, when we leave our NTC meeting, we start talking about why that business should move into our community. So that accurate data is really what drives. It drives quality of life in retail services. When you're trying to locate or provide higher quality services in your community, the accurate data is necessary, it's needed. It's what these businesses use to provide and produce their performance to determine if they're going to locate in your community. So an accurate count determines what type of city you have and what level of service you can provide in your community.
Absolutely, absolutely. And what she said about transportation, if you can't get there, you don't want to live here. If you can't get to work, you can't get to school, if it takes you 4 hours to get to the airport for a 2-hour flight to Philadelphia or something, it's horrible. You don't want to live here. Accurate information is how our groups, we've got a number of them here in Dallas-Fort Worth. One is the North Central Texas Council of Governments. That's where all of our cities get together and they talk about their needs. They talk about the amounts of funds that come here. We have a great MPO here. We have a great regional transportation council, and it's literally where the local governments get together and work together to get shovel-ready projects in front of these different groups and approved, so that as soon as the funding's available, either from the state or federal government, those projects are built. Now, what does it mean to have an accurate census count? You get a really good idea about where's the growth coming, where's it going, what do these hubs need to look like? Do these need to be 6-lane highways, 4-lane roadways, or what is it they need to be done? And if you look at what's going on, like in the southern part of Dallas County, and if you go up the northeastern Dallas County and into Collin County, those corridors, I mean, the growth is explosive. But what happened? Before any of that growth got there, there were a lot of highways and infrastructure that was being built in anticipation of that. And how did that come about? Good census information. And good census information provides dollars, not only federal dollars, but state dollars. And it tells us, hey, this is how much money we're going to have to spend from those pots of money, and how much money do we have to put together here to make that happen. Because I can guarantee you, one of the things that attract people to Dallas-Fort Worth is that in spite of the fact we got 8.5 million people here, our congestion rate has not increased in 25 years. And that's because through the good work of the North Central Texas COG and through the RTC, they have tried to stay in front of that growth. Because you go to other parts of the country, I mean, one of the things that brought Toyota here, they were in Torrance, California. Now you think about it, it'd take 2 hours from their headquarters to get to the airport, and you're in California. So how far are you from Texas? You're 4.5 hours. You're 6 hours from DC. And they said when they came to Dallas-Fort Worth, they were 40 minutes from Dallas-Fort Worth Airport, they were 20 minutes from Love Field, and 2.5, 3 hours from any place in the United States. And as long as we maintain that and keep in front of our demand, our needs, then we're going to continue to have this success. And that requires that we have good, accurate information.
And just to follow up from that, Drew, one of the questions on the American Community Survey is how long people take to commute to work. And I have a feeling that's a transportation data point, right?
That's one of the first things that people ask is how long does it take me to get where? Now, during COVID, I think what we all discovered, it's like that the North Dallas Tollway, traffic on that dropped by 70%. And why is that? Well, it's because everybody's staying home, and we begin to work from home. And the North Texas, or the NTTA's numbers show we're back up over where we were pre-COVID, but we still are not where we were projected to be, which means that there's a lot of things culturally that have changed about work and what the workforce does. But it's all about quality of life. You know, can I get home in time to go see my kids play their games? Can I go to the plays, the pageants, all those things that are really important? Or am I stuck on a commuter train or on a highway for hour after hour after hour? And that's the thing that we at the Dallas Regional Mobility Coalition are constantly looking at, is how do we reduce the travel time? And because that's all about quality of life and how much time you get to spend with your family and kids.
And Steve, I had a follow-up question on health equity. It's something that you and I spoke to a lot about. You've been a longtime advocate for addressing social determinants of health. How can accurate census data help your hospitals better understand and address the social drivers of health in the region?
Yeah, it's a great question. With accurate data, especially census data, when you look at the population, you look at the demographics, you look at age, you can see, especially in low poverty areas, where you need attention. We did a study about 18 months ago, and we looked at a 17-county area, and we actually developed a disparity ratio where things were disparate for people all the way down to the block level, not just to the zip code. And we found the following with adults, and it's not going to really surprise you, but in many other areas, there were problems with pulmonary functions, cardiovascular functions, diabetes, mental health, with a focus on suicide. In some of these areas, suicide runs much higher. And then finally, maternal and child mortality, real issues. Now, we even did a deeper dive and looked at children. And even though a lot of the children may have CHIP, many still don't. And we found that they had mainly respiratory problems, asthma, and you stop and think, I'll come back to asthma. Believe it or not, appendicitis that was not addressed. And that kind of shocked me too, that it was appendicitis. And also mental health being issues, mental health a big issue. But let's go back to asthma. If you have accurate information, if someone lives in poverty and they have a problem with housing, or it's got mold and it's got mildew, if it's roach infested, and they have asthma, they're going to show up at one of our emergency rooms and they're going to need rescue medication. And we can give the rescue medication, but then in 6 months they're going to be back. And that's why some of the hospitals here in the children's hospitals, particular in the Dallas-Fort Worth area, are actually identifying some of these, and they're going out and putting in new carpet and doing things that you normally wouldn't think a hospital would do, spending money to make the environment healthier for them. Same type of thing when it comes to a child whose teeth hurt. They're not going to learn at school. A child who's hungry, they're not going to learn at school. This data is got to be accurate to help us pinpoint specific problems to address the social drivers of health. And the same for adults, especially when you get in the senior population. We work with Meals on Wheels. In some cases now, they're taking blood pressure when they deliver the meal. And they're doing things to try to ferret out where we've got social problems and we need to promote health equity. It takes everyone working together. And people get tired of my, I lower the overall average IQ by being up here, but I use the example of Finding Nemo. We got to all swim in the same direction. When we do that, we can address what I call the needed improvement in health equity.
Great, thanks for that. So my next question, I'm going to move on to, I guess, the uses of population data in your everyday, and I want to frame this one for Andrea and Opal. I want to, if y'all could tell us how you use the data for economic initiatives, so whether it's using the data to bring organizations into the region or into your city. Can you tell us of some examples where you've used the data to spur economic initiatives?
I'm going to give you an example of one of our cities. They recently, the city of Allen is getting a large hotel and theme park, water park development. That company was not looking at either Allen or Topeka. It was looking at Allen or the Colony or Frisco. And so it didn't just say, oh, here's some land. It looked at land, it looked at population, it looked at saturation, it looked at average income, and it decided based on that what area of the Metroplex could handle their development where it would thrive. So it's more than just, oh, there's this many people here, we can do that. Businesses are looking for one or both, customers and employees, and both of those have to match. They have to be able to have enough customers to support it if they're a front-facing business, and crucially, they have to look at the workforce and the potential workforce, and they want housing to house their workforce. And so looking at all of that, it all has to sync up for a large development like that.
And we use that data, right? But we use that data far in advance because for Allen to be ready, they had to plan for that population growth that they experienced. So they have to use that for their water infrastructure when they're looking at where do they need to be expanding their water, where do they need to be increasing the size of the piping for their water. We use it for when we're working with the school districts on where do schools need to be located, what communities, what neighborhoods, where are we seeing the growth, what are the ages of those students? Are we going to be a one high school town or are we going to have two high schools? Where do those schools need to be located? We also have to use that data when we're talking about planning for economic development incentive opportunities because those businesses, when they're coming into, when they decide what region they want to be into, then it does become a battle between the cities. Who's going to offer what type of incentive to incentivize them to come into the community? That's also a planning instrument or tool when we look at that census data to determine how do we start leveraging the dollars that we currently have to grow those dollars so that you can be more competitive. And the data accuracy is really important when you're trying to compete. And why education in our communities is so important, because when information is not reported, your community loses out on those deals. You're not as competitive as a Frisco when your residents aren't accurately reporting all the demographic data that's on that American Citizen Survey, or when they're not completely or accurate or honest even on the income levels in that, because income levels matter. Number of people in the household matters, because they're looking at a trade area and not just a city specific. And so that data is critically important for you to have a competitive advantage and to even be competitive when it comes to attracting business to your community.
Yep, that's great. And I was just thinking, you mentioned the American Community Survey, which is great because the decennial census only asks a couple of questions, but there's the economic survey, the American Community Survey, there's so many surveys out there. And for most organizations that are looking for data, most of that data is underpinned by all of the census surveys and counts. So even if you go and hire a firm to help you with some of those statistics, it's all going to be foundationally built on the census data. So thank you for mentioning that one. So the next I want to turn to Drew and to Steve about long-term infrastructure projects. And so if you have accurate population data, it helps for long-term planning, as we spoke to. So if you guys could both speak to that. I wanted to mention for you, Drew, you've always said in a few of our calls that you kind of end up behind if you don't start. If you could speak to that, that would be amazing.
Oh, sure. You know, I mean, how many of us have moved into a beautiful new neighborhood and it's got a great little boulevard out there, 2-lane road that's real easy to get on and off of, and then all of a sudden they build a shopping center across the way, and then they build another neighborhood, and then all of a sudden you realize, oh my God, they've got to build a 6-lane boulevard through my neighborhood. And it's going to take how long? And, you know, you've got all these big trucks, and oh, there goes my windshield with a rock in it. I mean, it's all these kinds of problems. And what you try to do realistically is in advance build the proper size so that you're not always having to go back and backfill. But inevitably, you know, if you build it, they will come, and they do. They come big time. That's why you're seeing so much construction up there right now in the Allen, that whole corridor up there. And if you watch 380, they're trying to make that 6-lane all the way across, and the North Dallas Tollway is going all the way to 82. Now, my suspicion about it going all the way to 82 is so you can get to WinStar faster, but that's just me. But the bottom line is that I mean, and it sounds crazy. We sit down and talk about, we have maps of what the transportation system is going to look like in 2050. Now, mind you, I might be not here in 2050, but I mean, that's what we're trying to plan for. And you're trying to anticipate where the growth is going to be, what feeder lanes, what major highways, what thoroughfares need to be set aside so developers don't come in and build homes on it. So you got to go in and do eminent domain and oh my God, that's so expensive. But the bottom line is you always feel like you're behind. Now, I will say this, state of Texas, we're always behind on these kinds of planning. And why is that? We got 1,600 people a year moving here. They don't have this problem in Delaware. You know, they don't have this problem in New York. It really is pretty much true about Texas. They don't have this problem in Wyoming. And not only do we have to plan for new, bigger, et cetera, because you know, you hear over and over again from city planners, oh, you need to have more population density. We need to be more like New York, you know, where they have 28,000 people per square mile. We have 2,500 people per square mile here in Dallas-Fort Worth, and I think the state of Texas is something like 900. So our population density, no, that's never going to happen. We're going to spread out because we want to have our own patch of grass and we want to have our own 1-story, 2-story house. So to accommodate that, you've got to have the transportation systems, the transportation lanes, and the planning for 2050 is going on right now. So your grandchildren will have roads that they can ride on and depend upon to live and have a good quality of life. But it really is a challenge because you're constantly going through the ebbs and flows of what's going on in the stock market, the oil market, financing, et cetera, all those different things. And then the last layer of that is you got to maintain it. I mean, you know, just because you build a highway doesn't mean, okay, it's built and you walk away from it. No, You've got to maintain it. Otherwise, in 25 years, you've got nothing but a gravel road there. And you got to start all over again, which all of us who drive know what a pain in the neck that is. But the bottom line is, so it's a constant, forever, you almost feel like you're on a treadmill, just going backward, going over and over and over again, the same things. But it takes a tremendous amount of planning, tremendous amount of cooperation. And so far, in Dallas-Fort Worth, we've had that, and I'm real proud of that. And that's why we are, I think, the most successful metropolitan area in the United States. And one more Chamber of Commerce note for y'all that don't know, we're the largest inland metropolitan area in the world, which means that we don't have a seafront, we don't have a lakefront, we don't have any, but we're bigger than any other inland area like this. And we're unique to that, and we're going to continue to grow. And I hope we do. And the challenge is for all of us is to help make sure that you still enjoy the quality of life that brought you here in the first place.
I agree with everything you said. We do need to fix a few potholes in Dallas. I can assure you, I've had to replace 4 tires this year. But infrastructure and healthcare, it's extremely important, and let me explain to you why. We have a lot of data at the Hospital Council, and the hospitals mine that data because if you've got people that are migrating out or migrating in from different areas, you want to know why. Maybe it's a time to put a clinic in Allen, or maybe it's a time that you look at the infrastructure. And why is that important? One, you want it convenient for people, but more importantly, you heard what Drew said about transportation. People that can't get to the physician or can't get to the hospital or can't get to the clinic aren't going to come in most cases. And as a result, they aren't going to get the treatment they need. The other thing with infrastructure is you got to look at the infrastructure and the demographics. Just so you know, the pediatric population is projected by 2050 in Texas to double. And in North Texas, it's expected to even be sooner. 1 in 9 children born in the U.S. are born in Texas. That is a big pediatric population. Wow. So you have to look at the infrastructure. How many schools are going to be there? And you say, well, what schools got to do with health care? Many kids get their primary care from the school nurse. The school nurse is an important part of their health care. And hospitals, especially our children's hospitals, are really branching out and working with schools on how they can help in primary care and how they can screen kids for different issues such as mental health. The other thing you have to realize is hospitals are big economic engines. Our last economic survey that we did, and we're updating it as we speak, but the last one we did about 3 years ago, the hospitals in a 17-county area injected $38.4 billion back into the North Texas economy. And that's through salaries, that's through construction, that's through the ripple effect, as you well know how economic impact studies go. But I think one of the most important things when it comes to infrastructure is what are the services you're going to render. We don't necessarily have to build a hospital everywhere, but we may need a primary care clinic. And this changes a lot when you even look at the rural area. When you get into the rural area, the demographics, the census data are just, if not more, important.
One thing I would add about transportation, and you may be thinking of it when you're talking about health care, that we look at all the time, and I talked about congestion. And the reason we're always concerned about congestion is not just because of time, but it has to do with quality of the air. Because, yes, automobiles today are almost 99% cleaner than they were in 1971. I mean, you literally could start an engine of a car and have it right here in this room running with us, and it wouldn't bother us. You do that in 1971, we'd all be run out of here. But my point is that when you go from 2.5 to 3 million to 8.5 million people and all the millions of cars, you need them moving. Because at the end of the day, if you don't, you have more smog. If you have more smog, you have more asthma, and it affects the elderly and the very young in a very detrimental way. And particularly where you have in the inner cities where you got all the freeways, you go downtown and you get in the spaghetti bowl, that part of town, when congestion happens, the quality of the air drops dramatically. And it's really, and what I'm saying is that from our standpoint, in terms of trying to plan transportation, that is something we pay attention to, is health as well as everything else.
Yeah, very good. And I have this one, Andrea, I wanted to direct this one to you. One of the things I don't think we really associate with the census is advocacy. So one of the things that North Texas Commission does is they advocate for different reasons for the region, to improve the region. Can you think of an example where the North Texas Commission or someone you know has used that data to help advocate for different things in the region?
Sure, I can talk about one that happened last night, and it's advocating not to cut Medicaid. We're giving information to our Congress members that we know they're trying to pass a reconciliation bill. We know you have goals for cost savings. It is detrimental to the children and vulnerable in our communities to cut Medicaid, and here's why. Not just overall big numbers, but here's the amount of people receiving it in your district. Here's the amount of people receiving it in the state, in the region. And so using that accurate data, like you said, we're $25 billion that we're losing because of an undercount here in Texas. So I would say that's one of the key ways we use.
Yep. And you need to be able to pull all that data to give them the talking points. Exactly. Great. Okay, so now I'm going to go to everybody again. I'd love to, we've heard about how we use the data and the different ways it's used for planning and infrastructure and advocacy, but now I'd love to hear some stories about what happens when it's not accurate. So if y'all could think of ways that planning hasn't gone very well because you think that data wasn't accurate.
I'll go first, if that's okay with the panel. During the COVID, and I know people are tired of talking about COVID, we found out just how bad the public health system in this country was. The feds didn't work with the state, and the state didn't work with the local. Collin County was different than Dallas County. Dallas County was different than Tarrant County. Well, we had a pandemic on our hands, so what did we have to do? So what we did here in the DFW area, we worked with the health departments, but you got to realize when you get out in rural areas of Texas, the hospital is the health department. There is no real formal health department. So what we did, we joined forces with, many of you may not know, but it's the North Central Texas Trauma Regional Area Council. We call it the RAC. The state is divided into different trauma districts. And I've lived in a lot of states. I know with my accent you thought I was from New York, but absolutely Texas has one of the best trauma systems I have ever seen. And it's well run and well designed. But what we did, we worked with them in a 17-county area. And since we weren't getting good, accurate public health data, we had hospitals at least report every day pediatric, adult, ICU, non-ICU, people that had COVID. And we looked at it, and it helped immensely. When COVID first hit, it did not hit the pediatric population very hard. So a lot of the pediatric hospitals, we could shift adult patients to. And we could look at ways that we could balance what we had to do with the workforce. At the end, or towards the end of the pandemic, Omicron came in. Omicron hit the pediatric population. So then on the adult side, normally when we would see someone in an emergency room that was 11, 12, or 13, we'd send them to a children's hospital. We kept them, and we treated them in an adult environment to help balance it. So that's a prime example of where we didn't have good public health data, but people had COVID. We had to do something. It also helped us plan if we had to surge, where we had additional space. A lot of people don't know this, but when you're in the middle of a pandemic, you're not doing many elective surgeries. So you can go into your recovery rooms and move that equipment and do a makeshift ICU. And as a result, you can increase your ICU beds by just using equipment out of the recovery room. And I'm getting in the weeds now, so I'll stop. But that is an example of where bad public health data, we improvised, pivoted, and got the job done.
And two side-by-side kind of examples. One he alluded to earlier was Texas lost definitely one, possibly even two potential Congress members because of undercount in the last census. And I don't care what side of the aisle you're on. We don't even know what side of the aisle that potential new Congress member could have been on. Reconciliation passed by one vote last night. Every single vote matters, and we lost a vote. We lost a voice in Texas because of census undercount, and that will continue to have ripple effects. We're working with the Texas Census Institute to make up for that this next census so Texas is accurately represented. We can't have these overcounted states with 7 people in them making the decisions for all of us. But also I think it matters when, I talked to a few EDC members, board members preparing for this, it matters when businesses use, they all said this, businesses use the most conservative model to make their decisions. So it doesn't matter if a city is saying, we need a grocery store here and we have the population to support it. That business is gonna look at the data and it's gonna look at the population and say, no, you don't. They're not gonna take the word of the city council. And so it's contributing.
Taking my example.
I'm sorry. So it's contributing to food deserts. It's contributing to the lack of employment opportunities. It's contributing to the lack of clinics because they can't use the data to justify something that might have been a reach.
So she stepped over, and she's correct.
I'm so sorry.
For my community, we've actually literally been unable to attract grocery into the community because of the undercount. When we show the demographic data, when we show the population data. So that's one example. But another example, and Drew's going to say, get out of my lane, but it impacts us with transportation and infrastructure dollars.
6 lanes, I'm good.
It impacts us with infrastructure dollars. So when you are competing for grants, particularly whether it's the state government or the federal government, and we do both Texas and our U.S. Congress look at the demographic data from the U.S. Census, and they allocate your funds based on your population. And so when you have an undercount, that means you're getting fewer dollars to implement those projects. So when we're talking about planning for a new business that's coming in, and we look at the land use around a piece of land, and we know that that land use is going to generate and ultimately require 4 or 6 lanes of traffic, but the data doesn't support it, we're building 2 lanes and knowing that this isn't correct. But when businesses are who are helping subsidize the cost of that infrastructure, no business is going to give it to you because you're saying, no, our numbers weren't correct, and we know what our population really is, so we need the traffic impact analysis to say that this needs to be a 4-lane divided highway. They're going, no, it's a 2-lane arterial rural road, which completely changes the aspects of your community because your residents are coming to council meetings and saying, you knew this was going to happen. Why didn't you better plan? Shame on you for inconveniencing me having to get out. And so that count impacts revenues coming in, and it also contributes to business loss in cities around the country, around the state. And we've experienced on both sides.
Well,
And as Andrea and I were just talking, you don't get a grocery store, it affects food security.
Absolutely.
It affects health. The
Right.
revenue affects supplemental nutritional assistance programs, women in crisis. You can go down the line and it
Education.
all ties.
All in back into education, it's a trickle effect.
one of our key points about the census is it's hard to explain why it's so important because it's important to everything. So I'm so glad that y'all are basically all agreeing with one of our arguments. And also, Opal, I work with one of Opal's coworkers or colleagues, and he educated me on the entitlement city. And so there are specific grants from the federal government that you're only approved for if you're at a certain population number.
Which is that 50,000 population number. And
Yeah.
so when you're under 50,000, which we are, you rely upon the funds that go to the county. And then with all of the cities under 50,000, you're in a pool lobbying for why your city needs more of those
Yeah.
resources allocated to you. And so again, it impacts your ability to have the economic dollars and resources you need to provide higher services and a better quality of life for your residents.
And I won't make you say it, but there's no politics at all at the Commissioner's Court in Dallas County, just so y'all know. But you mentioned census, and have you ever, I would say from a planning standpoint, transportation, we've never had that problem. We're always behind. And wherever we built the road, it wasn't
fall
big
behind,
enough,
you never catch
it
up.
wasn't soon enough, it wasn't wide enough, it wasn't fast enough, it was all those things. And I will tell, how many of y'all have driven in Austin? Anybody in here? Okay. Y'all been on 130 that goes around? Okay, you can go 90 miles, 100 miles an hour out there. That road was originally built by a private toll company, and it was based on census numbers. They thought that whole area was going to grow and be full of people, and they went bankrupt, and TxDOT bought it for 10 cents on the dollar. But they still operated as a toll, just so you know. But then Tesla built their big plant out there, and guess what's happened? Now it's full of people. But my point is that a private company, and they invested millions of dollars in a toll system, was approved by TxDOT, it was going to be part of our state highway system, and they ended up having to withdraw because they said, we're going bankrupt, we got to get rid of this. And they sold it back to the state, but it was based on bad census numbers that they had when they first built it. But at least here in Dallas-Fort Worth, we have never made that mistake. We're just behind.
I'm sure. So we're almost up on time, but I'd like to end it on a more positive note, which is one of the things we're doing at the Texas Census Institute is we're trying to educate more people on the importance of the census, and we're working towards a collaborative effort for the 2030 to get more, hopefully, support from the state, but also to get more counties and cities working together to do more work to support the census. So I'd love to hear from you guys, especially Andrea and Opal, because I know that I work with them a lot on future census planning. What are y'all doing to support the 2030 census?
Well, first of all, we're working a lot with the Texas Census Institute, partly because I just provide the negative outlook for Angela, who believes in the good of all people. So we talk a lot about the political landscape and what the obstacles are going to be, just from a messaging point of view. Counting everyone is not a politically neutral statement anymore, and so trying to make sure we're making connections and relationships with the right people on the right committees to ensure that the census is funded well, that the research into the expansion and the maps, I know so much more about maps than I did a couple of years ago, are funded well so that it enables everyone working on the census to go in and get an accurate count.
Great.
And cities are partnering with agencies like the North Texas Commission and others. I'll be the incoming chair in September of the commission, and so encouraging more cities to get in organizations like that to collaborate, because when you are in a public-private relationship, you have the business support that is saying it's not a political statement, even though it's being made into a political statement. From a city perspective, it's very important to share how the census count impacts the resident at the resident level. And so oftentimes talking about why the count is important, they're going, no, the government is using it to do A, B, or C, and they're making it something other than. So we are literally bringing it down to when residents say, how did we not get that grocery X or grocery Y? And we say, did you complete your census? This is why the census data is critically important. We're also making sure that we're getting out into our populations that English may not be their primary language, or there may be a fear of government for whatever reason, and saying, this is how it impacts you here and why the value of that data is important. And so connecting and working with our schools is critically important, because it's often when that kindergarten kid or the elementary kid goes home to mom and starts talking about why this is important, we as parents and grandparents listen, and we're more likely to engage and participate in the process. And so we're really working from that perspective of this is why we're making it a personal thing for our residents.
Great. And I know it seems early because it's 5 years out, but there's so many counties and cities in Texas that haven't done census work before. So working with folks like Opal and her economic development colleague, Shane Shepard, we're able to learn from them best practices and then not only help them figure out what are some of the things that they can do to improve from the last census, but to also think about how we can apply that to other cities and counties to get more people participating.
Yeah, we're going to have about 3.5, 4 more million people that have never done a census in Texas. So, but at the Dallas Regional Mobility Coalition, we do a lot of outreach. We do a lot of awareness campaigns, and then we go thump these knuckle draggers' heads down there in Austin and tell them that, you know, the census is a good thing. You know, this isn't, it's not intrusive. It's people like us who use the information, and we use it to benefit all of Texans and our quality of life, and to get our fair share of federal dollars, state dollars, et cetera. But it helps us with planning. You know, where do you put the school? Where do you put the streets? Where do you put the water, sewer? All those kinds of things. And if you don't know how many people are already there, it's hard to know how many people to plan for. And so the accurate census data is just imperative. And we do have to and I call them the black helicopter crowd. You know, if you tell them where you are, they'll know. And I'm like, you have an Apple phone in your pocket. I mean, come on, guys. And it's just tremendously important. And I know that from a hospital standpoint, I think it's even more important that you get that accurate information.
Oh, yeah, you just heard Andrea say what happened in D.C. last night. It's got to go to the Senate. We're going to have cuts to Medicaid, CHIP, et cetera. And so I'm already talking to my board about what can we do as hospitals to get as many people on board on the census.
Yep. Very good. Thank you, everybody. Well, I think that's it for our presentation piece, or the panel piece. So.
We have time for a few questions. If anybody has questions for any of our panelists, please raise your hand and we'll come by. Yes.
One of the, first of all, great panel. Thank you for all of your contributions. One of the other things that you have all talked about but not specifically addressed is how housing instability is also connected to health disparities and education disparities. So I was wondering if any of you would want to talk a little bit about that section.
You know, I've read the book Housing First, and if you read that, it does stress the importance of that, related not only to health, but also to so many other areas of your life. So I'll just say that, and I'm sure the other panelists may have comments.
From our perspective, the census is very important. So when we're talking about housing, today, how you state housing could be a really positive thing, or it could be perceived as a negative. But where that population growth is going, and the data based on the demographics of that information will determine what type of housing, whether it's multifamily housing, whether it's single family housing, is it the tiny lot or ADUs? And so it really does, and our community is experiencing that pretty drastically right now, simply because of the inaccurate count and the demographic data associated with it. And so where 2010 census, so between 2010 and 2020, the city of Lancaster experienced over 1,500 housing starts a year. After 2020 to where we are in 2025, we've had less than 300 housing starts a year. And so that inaccurate data has drastically affected the builders and developers look at where they're looking to where they want to build, because they're looking at the data. As Andrea was saying, they determine where they want to go based on that foundational data. And when that data is inaccurate, it causes housing shortages, well, I won't say shortages, there's other terminology that's being used for it, but it does impact a community's ability to attract and provide quality workforce, livable, low income, however you want to use the terminology, housing for our communities.
I'd suggest to you that transportation is the key to what I would call affordable housing, so that you could connect an employee or a worker to their job and to an affordable housing situation. Because so often what you discover, particularly when you get up into newer parts, you know, up into what I call the corridor, that northeast corridor, so much of the housing up there is just out of reach for everybody. I don't even know who are these people and how can they afford these homes. But bottom line is, there still needs to be the ability for people to get up there and work. All kinds of jobs, all kinds of employment. But they need to be able to get from their place of employment back to an affordable home that they can live in. And that's why transportation and paying attention to transportation is so important, and to make sure that we don't have undercounts. that we don't miss people who are living in certain parts of Dallas-Fort Worth or ignore them, because not only, you know, again, when they don't have the transportation, then they can't get to the affordable housing, then they can't get to their health care, and it just, you know, then there's no education, and it just dominoes. And that comes from not having the proper information. And that's just key. It really is.
We have a question over here.
Nobody wants to talk about the Cowboys? I mean, come on. The Stars.
Sorry, my question's not about the Cowboys, but it is for you, Drew, although potentially other people on the panel as well. I'm curious, like, how y'all use data to balance the needs of, like, where the major population bases are currently versus where they're growing the most. Because, like, I'm thinking of the I-45 expansion in Houston, for example, which is going to be really disruptive to the city and is largely unpopular there, but is being done to meet the needs of a really rapidly growing population in the north suburbs. And so how do you kind of do that cost-benefit analysis with the data that you have?
Well, basically what we do, not like in Dallas-Fort Worth, and of course I'm glad you picked I-45. That's Houston. They're a mess, you know. But here in Dallas-Fort Worth, you know, we've got a number of projects that we're working on that we would like to see done. But we've done, it's like when we did 635 LBJ. And back then, the state had not made the policy change, which disallowed for there to be toll authorities or tollways to be used. And what you try to do is go in and figure out, okay, if we're gonna create this new channel, and I'll give you an example here, 345 downtown Dallas. You've got about 200,000 people a day who travel on 345 now. And I don't think there's any engineer that's taken a look at it and said it needs to be rebuilt, redone, et cetera. Now, how do you go about doing that? Because that's a huge connector for people trying to get back and forth to work. They're not going downtown, they're going through downtown. And how do you make that work? And it takes a tremendous amount of work. It takes local work. You're going to have the city of Dallas involved. You're going to have the COG involved. You're going to have the RTC involved. Then you're going to have TxDOT. Then you're going to have the federal government. And everybody's got to kind of get on the same page. And then you do an environmental impact study, and you try to figure out what is the best way for us to do this. And at the end of the day, what have we done? And my fear is for like big projects like 45, because I used to live in Houston, is that all you do is just create something you're going to have to fix later, because it just gets bigger and bigger and bigger. And if you go out on 10, as you're headed west out of Houston, there are a couple of places where you get on the highway. It opens up into 10 lanes, and cars just stop because it's like, oh my God, what have I done? I feel like I'm on a tarmac at the airport. But it takes a tremendous amount of effort, a lot of hard work, and a lot of coordination to get those things done. And at the end of the day, they're not decisions taken lightly, because they are very expensive, very expensive. I think the project in Houston is projected to cost somewhere around $10 billion. And, you know, one of the other things they try to take into consideration is, what does it do for air quality? What does it do? What's the impact on health and all those other things as those projects go on? And all I can say is pray for the people who have to live around it.
I'll also say that land and availability of land is a big piece of that as well. I'll use my community as an example. Loop 9 has been on the state of Texas plan since 1973. And Loop 9, the first phase of it, completion just happened this year, and construction just started about 24 months ago. But Loop 9 today, the population around it is very light, even putting it mildly. It's hardly anything out there today, but it's looking at what is going to be. But right now, only what will ultimately be service roads is what's built today. That's planned to be a 6-lane divided interstate elevated roadway at some point, larger than what Loop 12 is today around the Dallas area. So availability of land and the resources, and ultimately, as Drew just said, it's about collaboration. The state had it on its plan, but there was no coordination with any of the cities that are going to be impacted by Loop 9 up until about 10 years ago. And so once that collaboration starts happening with the MPO, the COGS of the various areas, federal dollars coming in, the local governments supporting and getting behind it, that has a lot to do with it as well. And it does impact, because the few farms that are out there today are absolutely not happy about the 2-lane road with the cars going 70 miles an hour coming through while we're, crossing the cows from one side of the pasture to the other.
All right. Well, we're really right on time. I know there was maybe a couple more questions, so hopefully if you have questions, you can talk to a couple of our panelists. But I want to thank Texas Census Institute and Angela and all our panelists here for such a great discussion on the importance of data. And I hope that, and the hope is, and I know this is, Angela would agree with me, is that when you leave this event, that you go back home in your spaces, in your communities, to your elected officials and ask them, so are we ready for 2030? Can everybody say that? Are we ready for 2030? I mean, that's the question we want. That's the driver, right? Because I think what we heard this afternoon was so critical. I mean, if we don't get it right, we don't want to be, in 2020, we were number one from 2010 to 2020, fastest growing state. I mean, the largest in numeric growth, yet we were one of 6 that had an undercount one of the 6 states that had an undercount. So we're number one, but we still had an undercount. What does that say? So, it affects our communities directly. So
And the rest of the country isn't really sorry we undercounted either, by the way, just so y'all know.
Yeah. So thank you all for your time and for all you do in your cities and your communities and your organizations, and thanks also to Texas Census Institute. And thank you all. So let's give them a round of applause. So we have a little break as we transition to our next workshops here. For those of you who are interested in the data tools workshop, there's still space there if you want to learn how to use some of the cool tools to find data that you need. Our other workshops are also on the other side of the conference center. So 15 minutes, and hope you can find your space. Thank you.
Okay.